Over to you, sir.
Yes. Good afternoon, doctors. Welcome to this webinar on the role of oseltamivir in flu management. This webinar is brought to you by Hetero Healthcare, an innovative pharmaceutical company. Hetero Healthcare, the journey began in 1993 with 30 years of excellence and 36 state-of-art manufacturing facilities. Hetero Healthcare has 300 plus products in portfolio and presence in 126 plus countries. 21,000 employees globally, and Hetero Healthcare is the largest closely held pharmaceutical company in India. It is amongst the largest manufacturers of ARV, APIs, and FDFs in the world, and has Asia's largest API manufacturing facility at ACZ Complex, Visakhapatnam, Andhra Pradesh. Hetero Healthcare is 360-degree solution provider, striving to fulfill unmet healthcare needs, reaching to customers across India with wide product range encompassing multiple specialties, pioneering in quality and innovation, and has the distinction of bringing 4 biosimilar products to market within 5 years of initiation. They are darbepoetin alpha, rituximab, bevacizumab, and adalimumab. During COVID-19 pandemic era, Hetero Healthcare, the pioneers in antivirals, offered Oseltamivir, Favipiravir, and Remdesivir to the patients, because of which, in August 2020, Hetero Healthcare received an award of Pharma Excellence for COVID drugs. Today's webinar, Role of Oseltamivir in Flu Management, we have got moderator Dr. Kapil Rathi sir with us. Welcome, Dr. Kapil Rathi. Dr. Kapil Rathi sir is Medical Director and Consultant at My Health Clinic from December 2006 till date, working as General and Critical Care Medicine for last 19 years, and is well equipped with all the general medicine, chest medicine, and critical care procedures. Sir was awarded by Governor of Maharashtra for excellence in work during COVID times. Has been part of trials for many MNCs and National Pharma in phase 2 and 3 trials, and working with various NGOs for health awareness by conducting camps. Dr. Kapil Rathi is Fellow of Infectious Disease by IDSA, member of ERS, ATS, ACP, IDF, ADA, RSSDI, and ICP, and has held multiple positions in various bodies. Welcome, Dr. Kapil Rathi, and over to you, sir.
Yeah, uh, thank you, Dr. Prashant, for that kind introduction. Thank you, Hetero Pharma, for conducting this kind of very.
Sir, you're inaudible.
I'm inaudible.
Yeah, a little more. I mean, sound is little less.
Okay, now it is okay.
Now it's okay. Now it's okay.
Okay, so thank you, Hetero Pharma. Thank you, Dr. Prashant, for all those kind words and for arranging this kind of informative webinar for all our general practitioners and colleague physicians. So today we are going to discuss about empirical use of oseltamivir in flu management. So let's go with this. So today my flow will be, I will be discussing something of healthcare challenges in monsoon and other seasons also and their diagnosis. What is the flu and what are the complications? What is the clinical evidence to use oseltamivir in these conditions? What are the guidelines, recommendations for empirical use of oseltamivir? So healthcare related challenges in monsoon, and for that matter, in all the seasons across all the 3 seasons in India, sometimes it happens that we have got flurry of flu cases which are not only particularly restricted to monsoon but also round the year. Why we are worried? Because they can cause influenza-like illness. They can cause H1N1, which is very still very common in our day-to-day practice, and also it can cause SARI, which is severe acute respiratory illness, which we have seen, and always COVID-19 was there for that 2-3 years. Now it has come down, but that was the eye-opener for all of us. Next slide. So there are a lot of challenges in monsoon and other seasons regarding the flu illnesses or flu-like illnesses. Next one. So if you see the Indian data over a period of time from say 2017 to 2022, the seasonal influenza A virus has been on the rise, and you can see there are more number of cases. There was some dip in between because COVID was predominant at that point of time, but after 2022 again flu has picked up, and as the cases are picking up, we are also seeing a lot of catastrophe or death because of flu. Next slide. So as the case goes up, your catastrophe also goes up. And this is the government data. Next slide. And typically Indian data. So if you see overview of influenza or flu in India, if you see the green bar, which is the latest 2019 data, we have got the cases which are getting double by at least every year. So if you start say from 2015, from 4,000 cases, they have gone to 28,000 cases. And same way, the death from 300 cases has gone to 1,200 plus death. So it's an exponential rise in the cases of flu, and obviously because of flu, there will be some mortality which we are seeing. So this is very alarming, and thus we need to address this kind of issue. Next slide. So if you go into the basics of influenza, there are four types of influenza virus: type A, type B, type C, and type D. Type C and D are not for clinical use for all of us because B only happens in the chattels and monkey. C is a very mild virus which can cause very mild respiratory illness without causing too much of a problem. The problem lies with influenza A and B, and of that, A is typical what we are dealing with. So A will have lot of antigenic variation or antigenic, there will be a lot of pandemics and epidemics because of antigenic shift and drift. What happens with influenza A? While B causes influenza or flu in the humans, but these are very mild. So these are the varieties of influenza viruses. Next slide. So if you see currently there are H1N1, H3N2, a lot of variety which are going on in the environment which is there, but we are more worried about H1N1 because that's a swine variety and which is very fatal in some cases. Next slide. So after seeing influenza A, B, C, and D, you can see how the flu virus transmit. That is very important. Flu can spread from one person to another just by simple coughing or by droplet infection, which is the most common variant of transmission mode for any kind of virus, especially respiratory viruses. And this droplet can, they can go as long as 6 to 8 feet that we all know from COVID times. And that's why we always advise our patient to keep away from the patient who have been infected, even at the home or at the office, whatever is there. And the most important part is that one has to have good hand hygiene and good environmental hygiene that has to be maintained during flu times. Most of the adult may infect other people up to the tune of 5 to 7 days after becoming sick because they can throw or they can shed virus up to 3 to 4 days once they get infected. And children might throw it again after maybe after a week also. So that is very important. So not only the droplet infection, but also the cross contamination is very important that we have to take. Next slide. So symptomatic differentiation of influenza-like illness, H1N1, SARI, and COVID-19 is what we have depicted here. So the fever, myalgia, cough, lack of energy, and sore throat, these are very common. ये चारों बहुत common symptoms है जो आपको सब में मिलेंगे, चाहे ILI हो, चाहे H1N1 हो, चाहे severe acute respiratory infection हो, चाहे COVID हो. But we all know COVID was very special, which was causing loss of taste and loss of smell along with diarrhea, which doesn't happen most in the flu or in the H1N1. But yes, breathlessness and everything are very common in H1N1 and SARI. That is the hallmark of that illness along with the symptoms what we have discussed. So this is in nutshell how do you can differentiate clinically amongst the two or three what we can do. Obviously, we can have a diagnosis on PCR and other things, but most of our flu infections are diagnosed in the OPD in a clinical way. Next slide. What are the emergency warning signs of flu sickness? Obviously, in children there will be rapid breathing. There will be bluish discoloration of the skin. People, whether the child might get dehydrated, it might be little dull, not be waking up, or maybe having fever with rash. This is very common with children. While in adult, there will be again simple, myalgia, headache, body ache, lack of taste, or sometimes anorexia, or sometimes difficulty in breathing. So that is very common, and obviously this you can correlate with the clinical conditions. In addition to above signs, you have to be very alert if you see, if any child or any infant is very unable to eat, or he is having trouble in breathing, or he has, a lot of signs of dehydration, because these are very emergency signs which you need to treat very fastly, probably admit the patient and get him treated. Next slide. So complications of flu is very important. That's why we are discussing here, because it can cause not only SARI, but it can cause pneumonia, bronchitis, ear infection, worsening of asthma, COPD, ARDS, and worse, the death. So these are the wide variety of complications which can happen along with the flu. That's why you need to treat flu in a proper way. Next slide. So how do you treat that? After knowing the complication, you have to treat, simple. The basics are always basics. You have to give the symptomatic management, which include a good bed rest, lot of fluid, lot of increased fluid consumptions, symptomatic medicine like cough suppressants or a paracetamol or a non-steroid anti-inflammatory drug for a severe myalgia. Most of our patients, in fact, close to 70 to 80% of our patients will get recovery in 3 to 5 days. But however, the malaise and the weakness might persist for a week or so. But in severe cases, almost in 15 or 20% of cases, they might require IV hydrations and other supplemental measures Therefore, there can be a severity of the flu which can be category B or C, which requires more attention, probably in some cases admission and observation. Next slide. So how do you treat that after knowing the the anatomy and everything? After knowing the complication, you have to treat it. That's why it's very important, and that's where antiviral drugs come into handy. Something like Oseltamivir, which is a fluid brand. So there are two types of drugs which are available as an antiviral. One is neuraminidase inhibitors and one are adamantins or M2 ion channel blockers. Most favorite and most common availables are neuraminidase inhibitor, which blocks the neuraminidase enzyme, which is very critical for the release of the virus or for the multiplication of the virus. And these drugs, the most important part is that this drug is active against influenza A as well as influenza B. And the examples are Oseltamivir and Zanamivir. Oseltamivir is available as an oral tablet and syrup, and Zanamivir is available as an inhaled also. And M2 ion channel blockers generally they interfere with the ion channel. Therefore, what they does they prevent the entry of the virus or into the host cell. That is very important. So this through this channel the virus can enter into the host cell. It prevents that entry. But the limiting part of this adamantins like amantadine and amantadine is that it only works against influenza A, doesn't work against influenza B. These are two kind of drugs which are available, safest and very easily available in the market. But most commonly or most preferred drug to use in all our flu patients is the neuraminidase inhibitor like oseltamivir. Next slide. I'll just depreciate you what is oseltamivir. It's a potent and very selective inhibitor of neuraminidase enzyme of the influenza virus. So it will have that binding with the influenza virus के जो neuraminidase enzyme होते हैं उसको block कर. Therefore, it works very well. It's a pro drug. It's not an active drug. It has to be taken into the mouth, and after going into the body, it becomes activated in the liver. It inhibits influenza virus replication. I've told you, and obviously, it not only halt the progression of the disease, but it also halts the progression of the spread of the infection. And it will affect against all the strains of influenza A and B, which include any strain, whether it is H1N5, H1N1, or even H9N2. So that's the beauty of the drug. Next slide. So if you see this cartoon, you can understand. If you see this virus or virion, which is a star shaped, or if you see in the center, there are the blue spikes and the yellow dumbbells. That yellow mushroom colored dumbbells are basically neuraminidase, and the blue ones are basically hemagglutinin. So that is very important. So if you see, there are 18 hemagglutinin and 19 neuraminidase and 11 neuraminidase which are available on the surface of the virus, and therefore you can have multiple combinations which can be available with influenza A virus. Now, if you see this slide on the downside, then there is a drug called oseltamivir, which is a neuraminidase inhibitor. So if you can see this drug goes and sits over that that mushroom shaped neuraminidase, and therefore it prevents that virus to get unfold, or it prevent that virus to release the virion, and therefore it can halt the viral replication, and in a way it can treat or restrict your flu virus to a particular area and can also prevent the spread of the infection. So this is how there is a mode of action of oseltamivir. Very simple. It is a neuraminidase inhibitor and it will prevent that virus to get multiplied. Next slide. So it was the first oral neuraminidase inhibitor which was approved in more than 100 countries, and it is approved by all the society across the world. Next slide. So it is available in India and all other, all the parts of the world. That is very commonly now available drug, and we can use in any country for that matter. It is one of the essential drugs which are available. So next slide. And it is being endorsed by all the societies. Now, how do you dose it and what are the recommendations? So it's very simple. If you are more than 40 kilo of weight, an adult or any child more than 40 kilo, you have to use 150 milligram in 2 divided dose, that is 75 milligram BD, or in a simple way 3 milligram per kilogram in 2 divided. So you can just calculate the weight of the patient multiplied by 3, and then you can divide it into 2 parts, or morning and the evening. The tablets which are available are, or capsules which are available are 30 milligrams and 75 milligrams. And there are also syrup which is available, which you can also use. So for children, the weight in kilos and the doses are given here. So if it's less than 15 kilo, you have to give 60
Sir,
milligrams.
you're inaudible.
Now, can you hear me
No,
now?
sir. No, sir. The little more, little louder.
Now you can hear me?
Now you can, okay, yes, sir. Now
Okay.
it's okay. Yeah.
So if your child weight is less than 15 kilo, you can use 60 milligram per day in two divided dose. Between 15 to 23, 90, and about 23 to 40 is 120 milligram in two divided dose. And as I told you, if the patient is more than 40 kilo, it is a very simple, straightforward 150 milligram in two divided dose, that is 75 milligram twice a day after meal. So that is very simple. And you can also use in a syrup form, what we use in our pediatric patient and also in the serious critical ill patients who are in the ICU. Next slide. So it's a very simple dosing, not much of complications. That is easy to use. Next one. So there are a lot of clinical trials for the empirical use of oseltamivir. And obviously, why we want to use oseltamivir? Because it not only reduces the lower respiratory tract infection, but also decreases antibiotic use, decreases the hospitalization. That is very important. If you see this slide, you can just make it that it decreases antibiotic uses by close to 27%. It decreases influenza-like lower respiratory tract infection by 55%. And it decreases hospitalization by close to 60%. That is a huge number. It will not only benefit patient, but it also benefit the healthcare system so that patient doesn't suffer too much, and also, there will be not too much of load on the hospital also. So this is the sorry, this is a very important statement what it is written here, that it decreases not only hospitalization but also the antibiotic use and the influenza like illness. Next slide. So reducing occurrence and severity of pneumonia due to H1N1 by early oseltamivir. So the trick or the guru mantra for using oseltamivir is to use it early in the disease. That is very important. As early as within 2 days of symptoms. That is the most important. So if you use early, as early as 2 days, you will get the maximum benefit. You can use up to 4 to 5 days also. That is also recommended. But I wish and I recommend to use early in the infection so that you get the maximum output from the drug. So that is very important. Next slide. Now, obviously, it decreases uh, uh, the day of admission of the patient and also the severity of the infection. Next one. So if you see this chart, or the time of onset of symptoms and the probability of severe pneumonia and probability of any severity of pneumonia, you can use this drug very early in the course of the disease, or even if you administer it after 2 days or 3 days also, still it will have some benefit to the patient. So that is very important. But don't miss on your patient. If patient comes to you after 2 days, 3 days also of the symptom, still you are eligible, still you are justified in giving empirical treatment with oseltamivir to this patient that will give benefit to the patient, whether it is any kind of flu, whether it is type A or type B. So that is very important. So my urge or my request to all of you is that try to use antiviral as early as possible. Try to use antiviral for proper 4 to 5 days of therapy. That is what is recommended. Next slide. So what does guideline says? WHO says empirical treatment is strongly recommended. That what we discussed. Treatment should be started as soon as possible. That is also very important. That's what we discussed. Laboratory confirmation of influenza virus is not necessary. In fact, a lot of people, in fact, only in the critical care unit or patient who are severely sick enough, then only we do the lab test for influenza. Otherwise, for an OPD patient, nobody does that, and we give all empirical treatment. Negative laboratory test still doesn't rule out, H1N1. Still, you can give this patient drugs because of your clinical judgment. And in higher risk individual who has been exposed to influenza patient, you can start with an empirical presumptive therapy. So that is very important. So if someone has got flu at home and you have got an old age patient at home, you can still start that fluvic tablet to that old patient because he or she might be susceptible to the infection. Next slide. So these are the recommendations. That is very important. So an early empiric supportive treatment and monitoring is very important with neuraminidase inhibitor to treat influenza where there is a local circulation, where there is a pocket, where there is an epidemic, you have to use it, and you have to use it in a mass way. Sometimes you have to use in that particular area or particular mohalla or particular chali, because sometimes there are local pockets which are there which get infected and you have to treat them very fast. So that's what happened in flu because of this antigenic variation. Next slide. So in adult with community acquired pneumonia who test positive for influenza, should the treatment regimen include antiviral therapy? Yes, you have to include antiviral therapy like an oseltamivir who test positive. In fact, not positive, still strongly feel, still you can use. That is what is the recommended. But if it is positive, then there is a no-brainer. You have to use it. And obviously, they not only decreases the timing of the infection, it decreases the hospitalization, but it decreases the death also. That is very important. Treatment within 2 days is an ideal if you start it, but if you fail to start within 2 days, you can still start or still can give up to 4 to 5 days of the symptoms. So that is very important. But I urge to start as early as possible. Next slide. So to summarize what we have discussed so far, proper diagnosis can and early treatment can prevent flu complication. Flu is not as simple as it looks sometimes. It can get worse, it can get complicated. You have to do a proper diagnosis and treat early. Empirical use of oseltamivir reduces LRTI, hospitalization, and antibiotic use. That is most important. I think it will save a lot of antibiotic if we use antiviral early in the disease because most of our flu patient doesn't require antibiotic. WHO, ATS, and Ministry of Health and Family Welfare recommended empirical use of oseltamivir. So this is one of the drugs which you can use empirical. We all use antibiotic empirically, which are not recommended most of the time. But this is one drug you can use empirically in a given setting, in a given patient after your clinical journey. So at the end of this, I just want to make you understand that flu is not simple as it looks. You have to treat flu. Use antivirals, which are available very easily now. The dosing are very simple. You have to just use the drug in a proper way and use it early in the disease. Thank you so much for your patient listening. If there are any questions, I'll be ready to answer. I'll be more than happy to answer.
Thanks so much, sir. We'll have a few questions. Has the incidence of viral infections increased?
Yes, the incidence of viral infection has been increased over past 2 3 years because of a lot of climatic changes. It has been increased because of lot of construction going around. It has increased because of possibly lenient approach by all of us. Till the time COVID was there, we were all very strictly binding to the protocols. Now we are very lenient, and obviously the global travel has increased like a lot. So yes, the viral infections are on the rise.
Generally, how soon the patient is brought to the doctor?
Generally, patient generally comes after 2 3 days. They don't
Two,
come on
three
day one. So that is the agony. Most of them will try Google. Most of them will try local pharmacy. Most of them will try maybe sometimes just an opinion from any other relative or any doctor. So generally they hit doctor's cabin generally after 2 to 3 days of the symptoms once they don't get benefit with the normal treatment.
And they would hit GP's cabin earlier than the consultants.
Oh, obviously, GPs
Yeah.
GPs are the primary. They are the prima facie for flu-like infection because they are the one who will see
First
most
point
of
of
them,
contact. Yeah.
and they are the one who need to be
Correct.
more aware about flu or oseltamivir. Yeah.
Should also, I mean, you have already answered this. I don't want to waste your time. What are the factors on which clinical response depends apart from early start?
So clinical response depends on, again, not only early start, but also depends on the severity of disease. One, two also depends on, other comorbidity, what are there with the patients, diabetic, hypertensive. Three, you have to be, viruses need a lot of hydration for patients because they really make you weak. They drain you out. So you have to do a lot of symptomatic treatment. You have to treat them early. You have to make them rest. That is very important because that is another thing because fatigue and myalgias are very severe in some flu. So I think the clinical response depend on how early you intervene and how good you monitor with the patient. And obviously, if your patient is young, non-comorbid and everything, you get a better response or an early response as compared to those kind of.
I mean, you have answered already this. Should we prescribe antibiotics concurrently?
Uh, that's a that's a tricky one whether you should use antibiotic concurrently. But to be honest, if I keep my hand on my heart, probably we all use that. So there is nothing to say no. But only thing, only my urge is that if you are using antibiotic, also think of antiviral. You have to use antiviral together in a flu condition. I'm not talking about a lower respiratory infection, which is a clear cut indication for other things. But for a given patient, most of our flu patient will respond very well in OPD. But start antiviral. If you have guts to start antibiotic, also have guts to start antiviral, which will be more benefit to your patient rather than antibiotic. I'm not denying about antibiotic, but also keep a thought in your mind, boss, this might require antiviral.
How well is oseltamivir tolerated, sir?
Oh yes, it is very well tolerated. Till whatever I can say from my experience and probably my colleague experiences, it is a very well tolerated drug, whether in children or in adult. It's hardly has got any major side effect. There will be little few here and there, maybe a nausea, vomiting kind of a thing, which is very common, which is a prodrome of flu also. So that is has to be done. Otherwise, a very safe drug. It doesn't have any interaction with any other drug like comorbid drug, like patients on anti-diabetic, antihypertensive, or an antiplatelets. You don't have to worry about that. You can give safely. The dosing is very simple. The duration is very simple. So you don't have any major side effect. That is what I can assure you.
Any specific contraindications or precautions?
Contraindication, only thing is that you have to be, if you are allergic to any drug in the past or you are been allergic to
Yeah.
any antivirals, you have to be a little more cautious. That is one absolute contraindication, I should say. Otherwise, precautions means you have to be give proper dose. That is very important. Precaution is that don't underdose. You have to give your patient full dose. That is most important. So calculate your weight and then you can go up to that and give for a good duration, at least 5 days. A lot of people
Yeah,
stop on day three,
correct,
day four.
correct.
You have to give it for 5 days to have that proper and pure effect of Oseltamivir. So that is very important.
Finally, sir, your take-home message for the audience.
I think I've been very vocal and very clear about what we were discussing. Antivirals are there in the market for so many years. Probably we are underusing that. Probably we don't know. Sometimes we don't believe in antivirals. We have to believe in antivirals. Plus, flu will be always there, and this is the right season. In fact, this is the most prominent season for flu. So next time, whenever you see a flu patient in your OPD and patient has gone 1 or 2 days not responding normally, I think that's the right time to introduce something like Fluvir or Oseltamivir for 4 or 5 days. Antibiotic is plus minus depending on your choice and your condition and patient condition. But antiviral is must in most of our patients. They respond very well. In fact, second, third dose onward, you will see the difference in the patient's condition. So only my take home message is, boss, you have to use antiviral. They are there. Just think of antiviral. If you think, you will write. And if you write, your patient are going to get better.
Right. Thank you so much, doctor. With clinical experience, I'm sure the doctors have benefited, took time in the afternoon. Thank you all the doctors who took time from the schedule in the afternoon, attended this webinar. Very formal, nice, educative webinar by Dr. Rathi. Thank you so much, sir, for explaining flu and its, possible dangers and oseltamivir, role of oseltamivir. Thank you so much. Thanks for your time, Dr. Rathi.
Thank you.
Thank you,
My
sir.
pleasure.
Thanks, marketing sales team of Hydro. Thanks, IT team. Sir, you can log off, sir.
Yeah. Bye bye.
Thank you. Thanks, Aishrikar.
Thank you, sir.